Now, when bringing out the diagnosis of infections, you must say the disease that the patient is having. You must talk about the probable causative agent. You must talk about the complication of that, and then you must speak about even the background of that infection. So, example, if you have a patient that is infected, he has let's say that the patient has meningitis. Is it clear? Diagnosis is meningitis. The complication of meningitis, you have to say the complication. Is there raised intracranial pressure? Is it clear? So it can be complicated by raised intracranial pressure. And then you say the causative agent, probably which causative agent, and then you say in the background of what? Is it the background of HIV? Is it the background of diabetes mellitus, or any other background of immunosuppression? Is it clear? So that is generally how you make your diagnosis in case of infection. If you have a patient that has an infected ulcer, like necrotizing fasciitis, your diagnosis is necrotizing fasciitis. Is it clear? Or you have infected ulcer, probably necrotizing fasciitis. You say now the etiology of necrotizing fasciitis is usually polymicrobial, most as a result of group B streptococcus, group A beta hemolytic streptococcus. And the complication of that necrotizing fasciitis can be what? It can be gangrene of the foot. Is it clear? You can have gangrene of the foot, and then the background of, or you can have osteomyelitis, which can later on complicate, and then the background is in the background of HIV or any other immunocompromised state. Is it clear? So generally that's how you bring out their diagnosis of infections. You have to bring out the infection, you bring out the disease, then you bring out the complication, you bring out the probable etiologic agent, you bring out the background of that disease. So generally that's how you make your diagnosis.